Our Journey. Executive Director Jessica Collins and founder Frank Robinson talk about the evolution of the Public Health Institute of Western Massachusetts. The founding vision. Often, public health requires bringing together diverse sectors and communities to develop solutions.
I started working with a coalition, and the coalition morphed or changed its direction to become a 501c3, Partners for Healthier Community. And that initiative was led by Sister Mary Caritas, who knew, based on her wisdom, that you needed some kind of freestanding organization, a neutral party, theoretically neutral party, that would allow all the various parties to come together as equals on a board, not operated by any entity, but a shared agenda. So Partners for Healthier Community came out of that ideal, that vision.
Building and growing through research and evaluation. We saw a need for research and evaluation expertise in the region, and we worked to fill that gap.
The adding on of the research and evaluation arm has been, I think, a tremendous value to the region.
Yeah.
I think that we've been able to lift up sharing stories and data, qualitative and quantitative, and we continue to get feedback from people that say, we used that report or we used that information to move our programming forward. And that type of feedback that we get is so motivating.
Yeah.
You know, to know that it's not just our organization, but we're lifting up other organizations as well.
This new version of PHC, the Public Health Institute of Western Mass, I mean, I think you are, for the state for sure, for Western Mass without a doubt, a shining star around research, particularly research that has a community, is grounded in community, centered in equity. I mean, I think that is unique in this state.
Our journey to advance race and health equity. Racism negatively impacts health, and it must be addressed to achieve healthier communities.
I think the other thing where we've really deepened the work that started under you is really trying to advance race and health equity in particular, where you launched that original report. And then we required trainings for staff and board. But we are continuing to evolve the conversation about what does it mean? What does it mean for us each as individuals at the organization? And then how does using a race and health equity lens inform the data or the stories or the coalition building and the involvement of residents?
Building a community-centered approach. Often, the solutions already exist within the community that you are trying to serve.
One of the things I would say would be get involved. You know, how do we continue to engage residents in the solutions, in what's right, what's going right, how do we lift up what's going right, you know, in our region, and, you know, including residents at every step of the way.
It's really putting people that you're trying to serve at the center and letting them lead the way. Often the solutions do exist. We just need to pick them up and strengthen them or help communities maximize what they know works for them already. So I think that's the new version of public health moving forward.